health series that we're doing for the next couple months. So this one is all about bloating and constipation. Super fun topic. So what is bloating? So 25% of the population deals with bloating on a consistent basis, but doesn't actually seek care for it or see it as an issue that we can actually dig deeper into, but we can. So bloating typically occurs after meals, and it's different than just like that feeling of being full. So bloating is a buildup of solids, liquids, or gas in the stomach. And it usually causes a distended appearance. It can also be painful. Some people will say like they look like they're 4 months pregnant. That is not normal. That's not just feeling full. That's kind of a step beyond that. And bloating can also be accompanied by constipation. So super fun if that is something you're dealing with. What causes bloating? So we have lots of different causes. We have celiac disease, ulcerative colitis, and H. pylori infection, low stomach acid, IBS or irritable bowel syndrome, cyclical hormone changes, that's a big one for women, carbohydrate malabsorption, SIBO, small intestinal bacterial overgrowth, that is a lot more common than you think, and then artificial ingredients or sweeteners actually changing the gut microbiome. So there's a lot of causes for bloating, which is why some people struggle to find the root cause. But we here will start by addressing bloating at the basic level first, and then we have some tools in our toolbox to dig a little bit deeper as well and truly find that root cause. But first, we want to make sure that we look at the basics. So asking yourself these couple questions. Are you chewing your food thoroughly? Are you sitting down and actually eating your meals slowly, or are you eating them while you're driving, rushing through them, eating them at your desk, that kind of thing? That can all impact bloating as well. Are you drinking your water predominantly through a straw or a bottle? Actually, when we use a straw, we're introducing more air into our stomach. So that's something to be mindful of. If you're dealing with bloating, it could be from your beloved Stanley straw. Also, are you walking 5 to 10 minutes after each meal? This not only helps with blood sugar regulation, but it also helps kind of get that food moving and not just sitting in your stomach. Follow up. Do you understand luteal phase physiology? So if you are a menstruating woman with a regular cycle, you need to understand what's happening into your body during the luteal phase so that you don't get frustrated with bloating and potential constipation. So if you are not already nailing these basics of chewing your food thoroughly, slowly eating, sitting down while you're eating, drinking most of your water through a bottle, so that we're limiting that extra introduction of air, and then also walking 5 to 10 minutes after each meal. We want to do that for at least 3 to 4 weeks if you don't already have those habits on lock. Then if it's still not working, you're still getting bloated, you're still feeling distended after meals, then we can start digging a little bit deeper. So let's talk about how we dig a little bit deeper, and then we'll go through our luteal phase physiology. So once we have all those habits done, we've been doing them for 3 to 4 weeks, bloating is still not going away. Let's first take a look at our daily food log. So are we seeing a lot of gluten? Are we seeing a lot of dairy? Are we seeing a lot of man-made or highly processed ingredients? If yes, this is kind of your signal to start moving towards a whole foods or single ingredient approach. Really keeping things simple, having carbs like sweet potato and rice, low grains, potentially going gluten-free if need be, potentially going dairy-free for a time being. But the reason that we can start actually doing that, going gluten or going dairy-free, if we keep a record of when our bloating is the worst. So this will start helping us see patterns in your bloating, which is going to be a response to a certain type of food or a certain type of meal. And since we all are tracking macros or tracking our food in some way, we can look back at that log and see when our bloating was the worst. So if you are someone that struggles with bloating, start adding notes into your food diary entries. That way you can look back and see, when you ate maybe a pasta with like a cream sauce, your bloating was really bad. So that could potentially be the gluten from the pasta or the dairy from the cream sauce. And then our third step there would be to complete a gut health protocol. And we'll follow the steps of removing the ingredient that might be causing your issue, repairing the health of your gut, and then reintroducing that food, because you don't want to have to go your whole life with avoiding certain foods. All right, let's go back and talk about our luteal phase physiology. So in a healthy cycle, keyword being a healthy and normal cycle, progesterone is going to become the dominant hormone after ovulation. So we're going to see a major drop off in estrogen and testosterone, and then we're going to see progesterone becoming that main hormone. Because of this, we may also see bloating and constipation. So constipation is pretty normal during that late luteal phase when progesterone has completely taken over, because it can delay gastric transit. So it's basically slowing down the movement of food through your stomach. That can definitely increase, constipation. Maybe if you're someone that goes to the bathroom multiple times a day during that late luteal phase, you might only go once. If you, only go once a day, you might skip a day, and that is obviously problematic. So some things to do there would be to increase your fiber intake, specifically from cruciferous veggies around that time period when you know you're going to start your bleed phase soon. If you're feeling constipated, definitely up that fiber intake. You can also add fennel tea. This will help to kind of relax the smooth muscles of the intestinal tract and get that food moving through. And then you could also, if it gets really bad, consider magnesium citrate. And again, that will kind of stimulate the movement of food through your GI tract. If you struggle with bloating, that is typically a sodium and potassium imbalance. Typically, sodium is going to be high and potassium is going to be low, and that's going to cause our body to hold on to more water. You might see a spike in the scale as well. So this is a pretty good signal that it's time to increase your potassium intake and watch your sodium. So sometimes we are craving saltier foods, but that can actually make our bloating even worse in that time period. Next, we can consider functional testing. So if we have done we've done the work to build those habits around our meals, we are moving, we are exercising regularly, we understand our luteal phase physiology, and we are still dealing with bloating or constipation, we can consider functional testing at that point. So our two options would be a full GI map. This is a stool-based test that will measure the amount of harmful and beneficial bacteria in the gut. We obviously want to have more beneficial bacteria than harmful. So we're going to be able to see the exact kind of balance of those two bacteria. And then it'll also help us determine the presence and quantity of fungi, viruses, and parasites. So this one is very helpful. Like I said, it is a stool-based test, so it's kind of gross to think about. But if you are interested in functional testing, I do have a partnership with a functional practitioner, and we can get those labs ordered and sent directly to your house. Do it in the comfort of your house, ship it back to the lab, and then we will go through the results together. You could also do a GI pathogens test, which identifies 22 common GI pathogens that could be causing symptoms like distress, whether it is bloating, constipation, diarrhea, acne, brain fog, really kind of runs the gambit of helping us identify those common pathogens. All right, so we know what causes bloating, but what causes constipation? Typically, we're going to see a combination of low fiber intake, low water intake, and low daily movement. Those are the biggest drivers of constipation, but we also have side effects from medication, stress, anxiety, and depression. They play a huge role, like I talked about in the first gut health video. Your gut is basically your second brain. So if you are stressed, anxious, depressed, it's going to play a role in your poops for sure. And lastly, trying to rush or force your poops is not good for your body. Everyone should be familiar with by now the Bristol stool chart. So taking a look over there, if we look at numbers 1 and 2, this is going to signify constipation. We want to be aiming for 3 and 4, which is in our healthy range. And then 5, 6, and 7 is diarrhea. So opposite end of the spectrum there. But this is why everyone has a fiber goal and a water goal, as well as a daily movement goal, because it just keeps everything moving, gives you those healthy poops that we all want, and just makes everything feel so much better. So next month, we're going to dive even deeper into gut health. We're going to address some other things going on in the gut. But if you have any lingering questions about bloating or constipation, please go ahead and drop them in our Slack channel, #TeachingTuesday. Alrighty. My girl, do we have any questions?